We're talking sexual health with Dr. Michael Phillips about the Center for Sexual Health at George Washington Medical Faculty Associates. Thank you for joining us, Doctor.
Thank you for having me.
What is the Center for Sexual Health?
The Center for Sexual Health is a new endeavor by the George Washington University Medical Faculty Associates to have a multidisciplinary center to address sexual problems in couples.
Couples coming in together or people coming in separately?
It can be any of the above. If you look at what we see in the newspaper that's advertised today as centers to treat sexual issues, it's all about men. And sex isn't great if only one of the individuals in the relationship thinks so. Our aim is to address couples, heterosexual couples, gay couples, as either individuals to start, couples to start. It's a customized attempt at dealing with couples across the board.
Well, what if you're not a couple? What if maybe because of these sexual health issues, you can't sustain a relationship?
Well, one of the emphasis in our center is counseling. And so first what we would need to do is establish why you're having the difficulty and what the problem is. And then we hope to be able to refer each individual to the appropriate specialist for either medical treatment or psychological counseling, physical therapy, pain issues.
Are most of these problems physical? Are they psychological? Or are they a combination of the two?
It's generally a combination. And I think that, human nature suggests that if you have a physical problem, you tend to overthink it sometimes in subsequent encounters with your partner. And so if we have a guy who comes in who has a vascular issue, and it may be a minor vascular issue, and he is experiencing sexual problems for the first time in his life, every time he gets back into bed with his partner, he's going to overthink the issue. And so it then becomes not only a physical problem, but it becomes a psychogenic issue as well. And we hope to address both.
We're talking a lot about guys. Addressing women's problems is really one of the things that set you apart.
This is huge. About 13 or 14 years ago, when Viagra was approved by the Food and Drug Administration for sale in the U.S., every time you saw an ad on television for Viagra, there was the notion that it was okay for guys to talk about their sexual problems. And men were coming out of the woodwork like crazy into the office to talk about sex. And there was very little, if any, attention being given to women. And it's a couples problem. As we age, men have hormonal issues, women have hormonal issues. Our bodies change tremendously as we age. And our center will address these issues in both men and women, which is something that just has been ignored to a great extent in this geographic area and across the U.S.
Well, for women, one of the things we hear about a lot is sexual pain. What are the causes of that, and how do you address it?
Well, it can be hormonal. There are other issues as well. We have an individual in our group, Jill Kraft, who's a gynecologist who's expert in this. We have pain specialists. We have physical therapists who are trained at dealing with pelvic floor issues, and hopefully we can get the women in to see Dr. Kraft so that we can address these issues for them.
And when you talk about addressing the issues, we're looking at everything from medication, surgery, counseling.
Right. For guys, we have the drugs, and you see them advertised all over, Viagra, Levitra, Cialis. But beyond that, we have penile injections, we have penile suppositories, we have vacuum pumps, and we have implants that we can place that allow men to have an erection on demand. It's not a one-size-fits-all remedy, and we hope to make all of these options available to the men that we see. We hope to make all of the options, medical, counseling, pain, physical therapy, issues to be addressed by our specialists for the couples that we see.
How's the field changed over the years? I mean, is there something that's a problem now that wasn't years ago?
Well, I think the main thing is that nobody talked about it. You know, when Viagra was approved, it gave permission to talk about it. And if you go to the movies, you get the impression that everybody else is having sex once or twice a day. And then you look at your own relationship and say, well, you know, what's wrong at my house? And I think that the changes in the media, the changes in the availability of the drugs that we can use to treat erectile dysfunction have given permission to the couples to talk about it.
Do you think most of the problems can be fixed or at least managed?
I think they can be managed, and I think that it's going to be different for each couple, because not every couple is going to be willing to take it on the male side to implant of a penile prosthesis. They may decide we'll take it to the medication and maybe take it one step beyond, and that's it. Others may decide, no, this is that important to us to take it all the way to a prosthetic implant. And more importantly, I think that what we have to make sure that couples understand is that you don't have to have intercourse to be intimate and to have a loving relationship. And I think we want to make that notion very obvious when we see couples and say, look, you know, let's define your goals. Is it intercourse? Is it to improve intimacy, which doesn't necessarily include intercourse? And let's take it from there.
First step is picking up the phone, making an appointment. 202-741-2288. That's 202-741-2288. And they make an appointment. They get in the door. What happens?
They'll see either myself or Dr. Benjamin or Dr. Jill Kraft. And then that individual will have the screening visit, which will include a good history and a good physical, and then we'll take it from there.